Every day she steps into a ward where courage wears tiny hospital gowns and hope sounds like a child's laughter in the face of pain. Meet the pediatric oncology nurse working with children and their families through the toughest journeys of all.
My name is Linda Litu. I'm a pediatric nurse, and my role in this unit is to take care of the patients, administer medication, and holistically be there for the patient, ensure they are feeding, they're getting their drugs on time, and the doctor is reviewing them. And in case of anything, I'm able to involve the doctor on duty.
But Linda isn't just any nurse. She's a pediatric oncology nurse, a rare kind of hero at the front lines of a child's toughest fight.
A pediatric oncology nurse is a nurse who has specialized in oncology, but most importantly pediatrics. So that means children 0 to 19 years. When you hear oncology, it's a journey. You work with this patient from the day of diagnosis to the day they are announced cleared or free from the disease.
It's not just about the medicine or surgeries. It's about working fearlessly with compassion and commitment.
So my typical day, so I come in the morning at 7:30 a.m. That's our reporting time. I get the report from the night shift staff. Then after receiving the report, I have to get to see the patients physically before the night staff go home. So that one will mean we are going like every patient has to be handed over to me. And then after I get the report, there's something we call priority, because these are very sick patients, as I stated before. So you prioritize the very sick. We start with those very sick. You'll find we have chemo drugs that we have to administer. We plan the day. So we start with those, the very sick, we give them the treatment. If we have any child who has a low, who is anemic, we give blood. And then now we have to talk to the pharmacy, oncology, to prepare drugs for us on time. So here we work with time, because now you see we have 12 hours in a day. And by 12 midday, we need to have administered all the drugs. So we get the drugs from the pharmacy, we come administer. And before we administer, we educate our patients, because these drugs are very highly toxic and we have to really involve the patients in the care. So what we call family-centered care, we educate them on the drugs, the side effects that they could get. Then of course we get the consent from the patient and we administer the drug. So after administering, we observe at that particular point. If there's any reaction, we involve the doctor, who is always here with us. Our shift ends at 7:30. So we work 12 hours, and at 7:30 p.m. we hand over the patient. And not forgetting, these are pediatric patients. We have to play with them. We have an hour play therapy.
Here, medicine meets play. Healing meets hope, and smiles, however small, make every long shift worth it. Some patients leave footprints that never fade. We ask Linda about one she'll never forget.
It's our first patient that we started with oncology, because this is a new department. So our patient went through the journey well. Before the diagnosis was made, the child was having stigma at school, because now they had a swollen leg, the cancer they were having, the type of cancer they were having, and they came in on time. We picked it quickly, the doctor made the diagnosis on time, and we started medication on time. And the child got through the process successfully. We even rang the bell for the child, meaning that she was announced free from cancer. And now she's back to school and doing very well. Last year she topped her class. That's a standout for us.
But beyond treatment plans and chemotherapy rounds, how do you hold space for children and their families navigating a storm?
What we do, we involve them in the care. So we start with them from day one. We tell them what the child is suffering from and how long the treatment will take. So as we walk the journey with them, we have, in oncology, we work as a multidisciplinary, from the doctor to counseling to nutritionist to play therapy and the nurses. So we always work as a team. Nursing is a calling, and I'm a proud nurse. I love what I do. And so what keeps me going is the smiles on these little children when I come in in the morning, and they're there waiting to see how the day will look like. You know, with medication, we have bad days. We have children who could react with the drug. That really gets to us as nurses, but we keep going because we know it's expected, and yeah, we work through it. As a unit, every week we have a debriefing day. So we'll talk about all our cases during the week on that day, and everyone will share their experiences. And at that time, we are not judging. So everyone will talk, everyone will say how the patients, the feedback they got from the patients, and then we just talk to each other. Actually, that's how we debrief. And then every year we'll have a team building day that we nurses will just go out and play, you know, have a little chat with each other.
So what keeps Linda going through the tears, the fears, and the toughest nights?
The day that stood out for me was the day that I discharged 4 patients, and these patients went through remission and they were cancer-free. That reaffirmed my decision, and I was happy as a nurse to continue doing what I do every day. To all nurses, to all oncology nurses, to all pediatric nurses, this is a calling, and I know we made this decision knowing what we are getting into. So let's continue doing what we do every day as we have fun with our patients.
From managing life-saving treatments to sharing in play therapy and emotional support, Linda's work is truly what it means to care for young cancer warriors. Behind every child's smile in a pediatric oncology ward is a nurse like her, fierce and relentless in the fight against childhood cancer. Her story reminds us that healing isn't just medical, it's emotional, it's human, and deeply personal. For White Coat Diaries, my name is Yvonne Kawira.